My name is Scott Harrod, and Heidi is here as well with me, and we're presenting today on the Volunteer Care Clinic, which is located in South Provo. Heidi and I have been volunteering here for the last few years and would like to share our experiences with you. So in Provo, there are about 17% of the population that are Hispanic and Latino. Um, about 30% of Hispanics in Utah live below the poverty line, and about 20% are uninsured. Now, the purpose of the Volunteer Care Clinic is to provide free Instacare for uninsured members of the Utah County community, specifically in the South Provo area. 4 to 6 primary care providers come on Tuesday and Thursday evenings from 5 to 8 or 9 p.m. to provide free services. And about 90% of the Volunteer Care Clinic's population are from the Hispanic and Latino community. There are many immigrants from many other countries, including Venezuela, Peru, Mexico, and it's very inspiring to learn their stories.
Okay, so we want to take you through the care clinic as if you were a patient coming here. So this is the entrance where there's a volunteer station here to greet them, to give them paperwork to fill out so we can enter them into our system and check them in, and also to do screenings such as during COVID, we had to make sure that no one was coming in with any COVID symptoms or even having been diagnosed with COVID. And so once they go through there, they are then brought to this waiting room where another volunteer is helping them with their paperwork. And they send them over to those little check in desks where other volunteers are helping them input all their information, get checked in. And that information is then taken to a nurse where they'll call them back to a nurse's station. So you'll see it in the back there. There are those two little stands, and they get their blood pressure, their temperature, and their weight. And as well, we wanted to show these cubicles here. They're volunteers from the Community Health Connect program are helping patients that may need other specialized care beyond what this clinic is able to do. So that's where they are able to get that. And then after this, they then go to the provider's room. This is a typical provider's room, and on the right, you'll see an exam table. To the left is the doctor's desk. And in the back, those two chairs represent that sometimes we'll have volunteer scribes and interpreters for the doctor if they need them. I've worked as a scribe before, and I have loved applying what we've learned in this class to this situation of such as cultural humility. As Scott said, many different people come, and it's amazing hearing their stories. As for the interpreters, we've been able to think about how we can better our interpreting, how the interpreters treat our patients based off of our lectures here. So we've loved taking what we've learned from 425 and applying it in a real world sense. Then these are just some of our references. And so thank you for listening. We've loved talking to you about the clinic.